If your dog's scratching nonstop, it might not just be dry skin, it could actually be mange, a pretty uncomfortable skin condition caused by tiny mites. Hi, I'm Linda from Vetster, and today we're talking about mange in dogs. As always, everything in this video has been carefully reviewed by leading vets to veterinarians. Let's get into it.
There are two main types of mange in dogs, Sarcoptic mange and Demodectic mange. Both are caused by mites, but they behave very differently. Sarcoptic mange is extremely contagious and makes dogs very itchy. Demodectic mange usually happens in puppies or dogs with weakened immune systems. It's not contagious, but it can still get serious if you don't treat it. No matter which type it is, your dog needs to see a vet for a proper diagnosis. Treatment often includes medicated baths, ointments, or oral medications that kill the mites. In tougher cases, especially with Demodectic mange, your vet might run extra tests to check for other health issues. Mange affects a dog's quality of life, and in bad cases, can even become life-threatening. That's why it's so important to catch it early. Let's talk a bit more about each type. Sarcoptic mange, sometimes called scabies, comes from mites that burrow into your dog's skin to lay eggs. This causes intense itching. It spreads quickly through direct contact with another infected animal. Demodectic mange is caused by Demodex mites. These mites actually live on most dogs already, and usually don't cause problems. But if there are too many, the dog's skin reacts. This usually happens in puppies or in dogs with weak immune systems. The way Demodectic mange shows up depends on the dog's age and how much of the body is affected. If it's just a few bald spots in one or two areas, it's called localized demodicosis. If it spreads across the body, it's generalized demodicosis. In dogs under 2 years old, it's called juvenile onset. In older dogs, it's adult onset. The most common kind is localized juvenile onset demodicosis, which usually clears up on its own as the puppy's immune system gets stronger. Generalized demodicosis is more serious. It can cover large areas of the body and is often linked to other health problems. Before modern treatments, it was very hard to manage and sometimes led to euthanasia. Even though Demodex mites can be passed between dogs, Demodectic mange isn't considered contagious. Healthy dogs usually don't have any issues with them. Both types of mange cause hair loss. Sometimes it's just a couple of patches. Sometimes it's most of the body, but you can't tell which type of mange it is just by looking. A vet can usually get a good idea based on your dog's symptoms and history, then confirm it with tests. With Sarcoptic mange, the main symptom is intense itching. Dogs will scratch constantly, wake up to itch, or even stop playing just to scratch. Hair loss usually starts around the belly, chest, ears, elbows, or legs. If left untreated, it spreads fast. All that scratching can cause broken skin, open wounds, and infections. You might notice greasy or crusty patches, redness, a bad smell, or even oozing skin. Demodectic mange usually causes milder itching, but you'll still see hair loss, scabby areas, or crusty spots. Infections can also develop and make things worse. In adult dogs, it's often a sign that something else is weakening the immune system. So how do dogs get mange? Sarcoptic mange spreads through direct contact with another infected animal, or by sharing things like bedding. The mites can't survive more than about a day or so without a host, so close contact is the main cause. Demodectic mange is different. Demodex mites are normal residents on most dogs, but when the immune system isn't working well, their numbers grow and start causing skin problems. That's why it's more common in puppies or dogs with other health issues. You can't diagnose mange just by looking. Other skin problems like flea allergies, food reactions, or infections can look almost identical. Your vet will do a full exam and may run tests like skin scrapings, hair samples under a microscope, fungal cultures, blood work, or even a skin biopsy. Sarcoptic mange can be tricky to confirm because the mites don't always show up in tests. A dog might have a serious case and still test negative. In that case, your vet might start treatment anyway, just to see if the symptoms improve. Demodectic mange is usually easier to see under a microscope. You can often spot the mites and eggs in a sample, but because it's often linked to other health problems, your vet may want to check the dog's immune system too. Treatment depends on the type of mange and how bad it is. For Sarcoptic mange, treatment usually includes oral or topical meds that kill the mites. If there's a skin infection, your vet might prescribe antibiotics. For the itching, they may suggest medicated baths or anti-itch meds. You don't need to disinfect your whole house because the mites don't survive long off the dog. But other pets in the home should be treated, just in case. Treatment usually takes about 4 to 6 weeks. If you stop too early, the mites can come back and the symptoms return. For Demodectic mange, if it's mild and the dog is young and healthy, it may go away on its own. But if it's more serious, or if the dog is older, you'll likely need stronger antiparasitic treatment. Your vet will also need to treat whatever's weakening the immune system. One important thing to know: don't try to treat mange at home. Using the wrong medication can actually make things worse. Dogs with mange need professional care from a vet who can treat both the mites and any other issues going on. Is mange an emergency? Not usually. It tends to develop over time, but you shouldn't ignore it. Sarcoptic mange spreads fast and makes dogs miserable. Demodectic mange can get much worse if you wait too long. If your dog is itching, losing hair, or their skin looks irritated, talk to a vet. Even a mild case can get worse quickly. And if you're not sure where to start, you can always connect with a licensed vet through Vetster anytime. Before we wrap up, just a quick reminder: mange often looks just like other skin problems, like flea allergies or food sensitivities. And sometimes more than one thing is happening at once. That's why treatment depends on the type of mange, how severe it is, and your dog's age and health. Most cases respond well with the right meds and support. In more serious cases, your vet may also need to address any immune system problems. The bottom line is, if your dog's coat or skin doesn't look right, don't wait. Thanks for watching, and take care of those pups.